Welcome. I'm going to get us started for today. I want to thank you for joining this week's cross-industry look at safer at-home practices and how you can reopen your business in a safe manner. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber, and I want to thank you for continuing to attend these sessions to get your questions answered, to get up-to-date information, and to provide feedback. Please put your questions into the Q&A feature. If they are specific to an industry, we'll do the best we can to make sure we show not only that industry's particular answer, but if there's anything different for other industries specifically, because this is a cross-industry section. Again, Q&A or chat for questions, and then we will ask them like we do every week. If you're new and you need more information, I'm happy to send that information off. And previous recordings. I think we're close to 100 hours, guys, 100 hours of these webinars that we've done since April. So we're happy to continue to provide that, provide those resources, and provide previous recordings for any information that's not covered specifically today. At this time, I'll hand it over to Jesse Rounds with Boulder County Public Health.
Thanks so much, Corinne. And just a little preview of where we're going to go. I'm going to try to highlight some of the sector-specific major questions we get and complaints. So hopefully that'll answer some of the questions that might come up for those of you who haven't been on, and those of you who've been on before. It's just a good reminder. In terms of our weekly case update, just want to show, we're continuing that downward trend that I mentioned last week, and that's a great thing. The update is that, yeah, we're seeing this lower case count. It's a little bit higher than last week. The per day case count last week was 8.2, I believe, and now it's 10, but that's, sort of fluctuating within a pretty narrow band, and that's great. As we've said for the last couple of weeks, we are continuing to see that disparity in the Latinx community, and it's something that's worrying to public health, and it should be worrying to the larger community. So, looking for ways to address that. Obviously, the big thing, it's in the newspapers, it sort of comes up in every one of our meetings, the return of CU, and that's, they're having, seeing positive tests, parties, there are people recreating more, and so that return is going to have an impact on our case counts. It's going to have an impact on our community, and we're watching that and working with the school with respect to that. And then last little bit of the good news is our hospitalizations are way down, and our testing, our positive rate of tests per test is way down as well. So we're seeing those happy, good trends, and that's contributing to some good news with respect to our position related to the protect our neighbors phase of the public health orders. So I'll get into that in a little bit. In terms of public health order updates, the next session after this is going to be about food service, and there were some updates to the food service regulations, and really they have to do with glove wearing and the reopening of self-service for beverages. And then there was a change in the most recent public health order. In previous public health orders, alcohol sales after 10 p.m. were not allowed, and there seemed to be some ways to get around that. And so the guidance has been clarified that you can't sell tokens, for example, to allow for sales of alcohol after 10 p.m. So that's all clarified in the orders, and Zach and Lane will go over that in more detail in the next session at 4. So just other reminders, masks are still required in public indoor spaces. You need to put a sign at your front door letting people know that masks are required for entry. As a business, you can deny service to those who can't or won't wear masks, and the state has provided guidance with respect to that. And I really encourage you to to read that guidance if you are concerned about how you can either provide guidance or provide services or deny services. So just make sure you're aware of that. How we can help as the county, this webinar is a perfect example of the information sharing. Corinne and the chamber have been incredibly gracious in hosting these and really getting our word out to the community. And it gives us an opportunity to hear what the community has in terms of concerns. We are continuing to interpret the orders as they come out and working with the state to clarify any questions that come up either in these sessions or as we're working through enforcement and communication as well. We are continuing to work with businesses that have either sick employees or outbreaks to try and address questions and also create plans for them in the event that occurs. And then we want to be a resource conduit. So we have links on our website, and we also I encourage you to go to the CDPHE website, which is covid19.colorado.gov. Tons of information on that website. They've gotten way better about updating it very quickly. So just encourage you to check out those resources. Now, I mentioned before, I want to sort of go through some of the commonly asked questions, some of the things we hear as complaints for each sector. And I tried to get as many sectors as I could. If I missed your sector, we can definitely talk about it at the end of the conversation here. But so field services, that's real estate, landscaping, and even sort of apartment management, I think would fit into this. And really want to just remind everyone that masks are required in shared spaces. Things like this came up recently, laundry rooms. If you have a shared laundry room in an apartment building, people should be wearing masks there, and the apartment manager should be putting signs up at the door to those spaces saying masks are required. In terms of food service, again, Lane and Zach will go over that in the next session, but the glove rules are sort of more aligned with food safety regulations. What I mean by that is you as employees will need to wear gloves in any situation where the standard food safety regulations require you to wear gloves. Limited healthcare, continue to wear those medical grade masks. That has not changed, hasn't changed since limited healthcare opened up, and just want to remind everyone of that. Personal services, masks for providers are still required. And one thing I wanted to bring up there is we continue to get questions about face shields and masks. If you are providing a service where your customer has to take their mask off, then you need to wear a mask and a face shield, both for personal service and limited healthcare. In manufacturing, continuing to follow the spacing guidance, 6 feet social distancing as much as possible. In office-based businesses, this question came up the last, 3 or 4 weeks since the mask order was clarified. And that is that if you are in an office, it is a public indoor space, you need to be wearing a mask. The only time that's not true is if you are in an office by yourself with 4 walls and a door where you are alone, and then you can go without a mask in that situation, but you should have a mask nearby in case someone knocks on the door and comes in. Retail, I mentioned it before. This is probably our most common complaint. Businesses are not maintaining signage at the front door reminding people that they must wear masks to enter. And that's still true. Events, outdoor events, limited to no more than 175 people. Indoor events continue to use the space calculator to figure out how much space you can, or how many people you can have. And one thing I should mention for the outdoor events, that limit is a maximum based on the space you have. Again, you need to, if you have a small space that can't fit 175 people socially distanced, then that max number is whatever you can do maintaining 144 square feet around your customers. Places of worship, if you plan to have large outdoor events, please do contact us. We're here to try and help everyone navigate these rules. And we know that places of worship and communities having life rights have lots of questions, and we want to help. Indoor recreation. Oh, okay. I need to be louder. Sorry. Indoor recreation. Masks are required in all indoor public spaces. Just that I need to reiterate that as many times as possible. And then this came up recently for outdoor recreation. If you are participating in a sport or any sort of activity where you will not be maintaining 6 feet of distance from the other participants, you need to be wearing a mask. That's running, that's playing soccer, that's playing ultimate frisbee, polo. I don't know. That's the first thing that popped into my head. That's weird. But if you're outdoor playing a sport or indoor playing a sport, you need to be wearing a mask. That's really the easiest way to think about it. And that is it for my sector guidance. So if I missed a sector, let's talk about it afterwards. But I want to jump to protect our neighbors. The really good news for this is we have completely met 6 of the protect our neighbors metrics, and we've partially met 3 of them. So we are getting closer to the point where we will be eligible for protect our neighbors. Whether we move to protect our neighbors has to do with whether we maintain that status of meeting those, and then whether the state accepts our application if and when we go that way. It is up to the public health director, the commissioners, and the executives of the hospitals in the county to agree to apply for protect our neighbors. And that's a discussion they haven't had yet because we haven't even gotten to the point of meeting the meeting the requirements. So we're going to keep having that discussion. With that, general updates at 3 p.m. every Wednesday, and special session today, that's food service and restaurants. And then the Spanish language session occurs, it's recorded and then released in collaboration with the Latino Chamber on Thursdays. And with that, please do remember to email us if you have questions, covidbiz@bouldercounty.org, or if you have complaints or concerns, you can call our call center 9 to 2 on Monday to Friday, and those come to us, and then we reach out to businesses who are impacted by the complaints and concerns we receive. So with that, happy to take questions.
Thanks, Jesse.
Yeah, thank you.
So this week's special session is restaurants, food service, and so forth. Next week, we are going to be doing outdoor and personal recreation. I know we have quite a few on the call today, so we'll go into detail next week and maybe talk through some of the current issues occurring on next week's 4 o'clock session. So I'll send the link out for that. So the special session last week was about residential property owners and managers. We have actually a question from a commercial manager who's having trouble with a tenant who refuses to wear masks wear masks within the building. They have mask signs posted everywhere. They cross paths with others, and they're wondering what steps they can take as a building owner to ensure mask adherence by their tenants. How do they enforce it?
So, without getting into the legal side of that, I would say having a conversation and explaining that you as the business owner, as the building owner, are responsible for ensuring that everyone in the building is complying with the orders. We can have a conversation with that business if you want us to contact them. But from a legal perspective, I do not know as a building owner what rights you have. Lane, I don't know. This is something we could talk to our attorneys about. I don't know what the answer to that question is.
My recommendation would be to certainly have a direct conversation with the person, alerting them that obviously this is needed to protect both their health as well as the health of everyone else in the building. Back to Jesse's piece on legal, that's probably something where you may need to talk with your attorney, looking at what are the lease requirements. But I know typically when you look at a lease, it may have generic language talking about that there will be lawful actions by the tenant. So if they're breaking the law, that's kind of potentially grounds for something that violates the lease. So I know that's one of the big factors that the city looks at as far as for compliance with licensing for landlords through the city, is that their tenants will be lawful. So I think those pieces, talking about how this has a lot of impacts that can, and again, that's where you would need to look to see what's within lease language. If are they in violation of lease language by their actions, by again breaking the law. So, but I think ideally a direct conversation saying this is required. It's not optional. You need to do this for all of our safety, and there is potentially penalties that can come with it.
And because the mask order is the law, a lot of the commercial, a lot of the commercial side, they're using the leases as that basis for the conversation. But if it becomes an issue, you can contact Boulder County Public Health to contact a business and let them know that they've heard, there's been some concern about mask wearing at that business, correct?
Yeah, I thought the scenario was like a tenant in an apartment complex. So they obviously they are the business that we would contact. So now it's a specific person. So, but that's what I would encourage the landlord to do is look with that tenant and have them really understand what they're required to do.
Okay. Jesse, I think you have some background noise going on in the background on yours.
Okay, I will shut my mic off.
Keep it on mute while we're waiting. I think somebody else thought it was me too. If Boulder County ends up moving into the protect our neighbors phase, will indoor events be allowed to be up to 50% of the posted occupancy, or will we continue to go by the social distancing calculator?
We would follow the protect our neighbors allowances. So again, these are hypothetical because we're still a ways off from that. And so even though we've made progress, there's still some big hurdles to get over. And again, we're not sure what things are gonna look like if we're gonna see a backslide where we no longer meet all the 6 that we do. But we would not plan to do something different than what the state allows. We've been consistent with the state orders as they've evolved.
Okay. So let's talk a little bit about gloves. So you talked a little bit about the glove changes within food service. I think we have some retailers that are wondering if there's been any changes to the glove rules for retail as far as that goes. And then if you could explain again when gloves are needed in an office environment, that'd be great.
Sure. So I actually, Corinne seeded this question for me beforehand, so I quick checked the regulations, and in retail, gloves are still required when you're interacting with customers, and they're recommended outside of that as well, just handling products and things like that. So that is still true, still in the regulations for retail. In terms of office environment, there's nothing in the office regulations that say office employees need to be wearing gloves.
So back to retail, because there haven't been many changes in it, I think there's still questions, do we still have to do this? And one of the pieces falls around the cleaning and quarantining of products, specifically soft goods, trying on goods. Are there still recommendations to quarantine products after they've been tried on, clean products after they've been touched?
I didn't get a chance to look at those regulations. I have not seen any changes to my knowledge. But I can look into that, whether the regulations have changed with respect to quarantining and cleaning products. But as far as I know, there have been no changes to those regulations.
Yeah, we've not made any changes to our recommendations on those kind of timelines. So that document has not been edited. So we would still recommend that. It's a low risk, but we still don't want people to try something on and then it go right to another person, or, again, that exchange, because there is still some risk. So any management of those products is going to be helpful.
So the document that Lane's referencing is a document that's on the cleaning and quarantining of retail products that is on the Boulder County site. It's kind of a nice guide giving you recommendations. I will include that in this week's email as a reminder link, just because we have had at least one question about that this week. So I'll do that. All right, so here's another recreation question for you. This is an indoor tennis court. Is a face shield acceptable for indoor tennis where social distancing is also strictly maintained? Prior to the statewide mask order, we were limiting the number of participants, ensuring strict social distancing per your standards, and they had no infections or exposures. So can they place a face shield for a mask?
No, the regulations are clear that indoor public spaces, everyone must be wearing a mask if they're over the age of 11 or over, I should say. And we recommend, and Lane, correct me if I'm wrong, 3 and older, we strongly recommend mask wearing for children 3 and older as well.
So it's an indoor tennis court because it's indoor, and then social distance, even with social distancing, you still need to wear a mask, just like all the other indoor properties.
Yeah, unfortunately, there's no provisions under the state mask order that allow for you not to have a mask on indoors when there's other people around.
Okay. Are there any differences between essential and non-essential businesses, for example, grocery stores versus non-essential retail, on how they confront mask violators walking in?
Nope, regardless of essential, non-essential, the mask order at the state level is all people must wear a mask inside. And we recommend, if you can provide alternatives, please do. But you have a right to, anybody, essential, non-essential, has the right to deny service based on the mask situation, whether that's a medical condition or just a desire not to wear a mask.
Okay. So we've had CU classes started this past week. We've had the move-in. Any updates on just, I know you talked about CU is doing some of their own contact tracing, and they're doing testing. Any trends you're seeing, anything you're seeing that may impact us as a community, or are we doing a really good job communicating the protect our buffs kind of messaging?
I would just say that I know CU has been very proactive planning for the arrival of students. Many students came with test results already, and then they did screening of quite a few thousand of students. They saw a very low percentage of positive tests, so that was incredibly great to see. I think the big problem we've seen is really the weekend evening party activity. So lots of people not social distancing, not wearing masks. So those are the problems that we saw months back that caused huge spikes. So we still have grave concern about that. But I know both the city of Boulder and CU are being very, very proactive on that. So lots of tickets, potential code of conduct issues for students. So we will be in conversations with them tomorrow on kind of where things are at. If there's problem addresses, we also will follow up as Boulder County. So we sort of have 3 different pieces of enforcement to address really ongoing problems.
So the city, the county, and the university, if it's a student, can take has a role in it. There's a lot of talk about Labor Day. Why? What's about Labor Day that public health might be concerned about?
I mean, yeah. Sorry, Lane. Go ahead.
Just the trend we've seen is the kind of the major holiday weekends, Memorial Day, 4th of July. We've seen big upticks in disease. Just more people are congregating, having parties, kind of trying to go back to normal, and we're still not back to normal. So all our messaging still applies. So just because it's a holiday weekend doesn't mean you can now be around people without social distancing and wearing masks. So that's our concern, is we've just seen the pattern for the last several kind of major holidays that have happened during COVID.
Okay. We're gonna go back to mask wearing. A lot of people are commenting that they see people wearing masks below the nose. What's the proper way to wear a mask, and what's the message you can say as to why the nose needs to be covered in the mask wearing? I know there's a lot of funny pictures out there on how to properly wear a mask or how not to, but maybe we can talk a little bit about there you go, there, Elaine.
You have a model. Look at that.
There we go. We could take a picture of that. What's maybe a message that someone could say as to why you need to cover the nose as well?
So I would say, I mean, the message is that you breathe out of your mouth and your nose, and what we're trying to address is mist, the spray coming out of your mouth and nose, and it comes out of both, and you just need to stop. That's what the mask is there to stop. And if you, I would say, I don't have any evidence of this scientifically, but just from having worn a mask for the last however many months, once it's below my nose, I breathe out of my nose almost immediately. And so that mask is there to stop to stop mist from both your nose and mouth.
Okay. So we talked a little bit about teams and personal recreation and team recreation and, needing to wear a mask. What's some recommendations to allow for those mask breaks when it's becoming hard to wear that mask? Should they be outside, distance, take a little break, come back? Is there a recommendation for some of those teams to allow those kids to have a little bit of break from it, or do they need to keep it on the whole time?
So I would say that most of the sports associations, like U.S. Soccer and USA Hockey and some of those other sort of umbrella organizations, have put out recommendations, and we, along with the state, have recommended that people take breaks. In fact, the guidance says if you need to take a break, do. And that's the one time indoors even that you can take your mask down to catch your breath. Although we recommend, if you're indoors, say you're playing basketball, have a side door open so that you can take a step outside, take your mask off, catch your breath, go back inside. Corinne, you were talking about your son playing soccer, and I think, leagues that are looking at, hey, every half we need to take a 5-minute break or 10-minute break just to let people have some water and catch their breath. Especially it's very hot, very smoky. That's just good practice anyway. And then you add the mask in. This is a great way to take a break, let everyone cool off for a second, and then go forward. But in terms of like a written recommendation, I'm not aware of anything from the state with respect to that. I would look to your sports sort of umbrella organizations for that.
I'll say the coach did a wonderful job when they were socially distanced. Stay in your places, pull down your mask a second, take a breath, put it back up. It was really well done. And allowed a break, especially since they were outside. I will say that a recommendation that was brought forth a couple weeks ago for offices is that if you have staff that's wearing a mask all day and not used to it, maybe they take a walking break. Maybe the next time they go outside and take a break so they can pull down their mask and have a little bit of time away from the mask, as long as they're distanced from others. I got a comment from someone that said there's recent studies that address the mask below the nose, that the virus lives in the nasopharynx. So breathing out the nose will put other people at risk as well. So
it's a really good point. There's a reason that when the common way to do the test is to put a Q-tip up your nose. That's where it lives, or where a common location for it. So that's a really good point.
Yes, I've had the test. It feels like they're going well beyond your nose, but that's for sure. All right, do we have any more questions out there, either in the chat or on the Q&A part? So just to, there are some municipalities that also have mask orders. I know Louisville extended theirs indefinitely as well. Boulder County is following, the state extended theirs, and Boulder County also has one. So make sure you're keeping it up to date with your municipalities. If you are currently extending out into curbside or into your right-of-way areas, some of the municipalities are extending the dates for those options as well. So make sure you check with your municipality. There is one more question that comes in. To clarify on the age, does Boulder County require masks for age 3+ or just strongly encourage?
Just strongly encourage. We're in line with the state, 11 and older. We just strongly encourage. We've seen more and more research that it's safe, and also we've seen increasing infection rates amongst our younger populations, and so we want to protect them.
Okay. We'll give everybody a couple minutes back in their day since we have no more questions that come in. Reminder, we have these every week at this time for a cross-industry focus, but as many of you do, you can send your questions between these times during the week. I often raise those questions during these webinars so that other people can hear the answers as well. And that's what Jesse was trying to do as well with the common questions between the industries. So feel free to send them to Boulder County, to myself, and we'll try to get them answered and then also answer them for others throughout the week. The very next session at 4 o'clock will be for restaurants and food service. And then next week's 4 o'clock will also be for personal and outdoor rec, so that we can have another conversation, because I think there's still some uncertainties and some clarifications needed on certain pieces, particularly around the masks. I hope everybody has a wonderful day. Stay cool, stay healthy, and we'll see you next week.
Thanks, everybody. Thanks, Corinne and Lane. Bye.